Hi everyone. So recently I put out on Instagram a poll and I asked you what you would like to hear me speak about. So the next thing you have all requested I talk about is facet joint pain. Now facet joint pain occurs, if I show you the model, the facet joints can be located. So if we see, so this is the lumbar spine here, all the way up through the thoracic spine and up, a bit squiffy, into the cervical spine up here. Now along the side, you can see, if I show you like this, if we take here, so this pair of vertebra, where they meet, it's a bit difficult to see, but where they meet is the facet joints. Similarly in the lumbar spine, for example, if I just turn it round, it's probably a better view for you, where this vertebra meets this vertebra, just that joint in there is called your facet joints, and you have them on both sides going right the way up through the spine. So that's what the facet joint is. Now normally the ideal posture, the bottom part, so the lumbar spine, has what's called a lordosis, which if I show you is something like that, which basically means a curvature, so an arch in the back, and that's natural. But sometimes, so if we just still focus on this part here in the lumbar spine, sometimes that lordosis can be exacerbated for whatever reason, and as a result this is called hyperlordosis, where the back is really put into maximum extension. So this is a side view. So from the front, the core, so the front of the core muscles would be lengthened and as a result weakened. And then if I spin it round at the back, so these knobbly bits, so what you feel in your back there, the core at the back of the back would be tightened because shortened and therefore also weakened. So what we want is an equal force going through the front and going through the back. Now, as I've mentioned, with facet joint pain, you get shortening here, lengthening there, an imbalance of the two sides, and as a result, weakened core. And with facet joint pain, the pain can result in extension. So when someone, say, has to, wave, they have to naturally arch their back. If their facet joints are already really abutting one another, then when they do something like that, so hi everybody, then they're increasing that tension within those facet joints and you can get pain there, so into extension. Alternatively, if a patient has to side bend for whatever reason, pick up something from the floor, for example, or twist round, if the pain, so if the pain is on this side here, if I show you this side, when they arch backwards, they're going to really abut one another, and if they twist round that same side, probably a bit difficult to see on this, but if they arch back, that's going to cause them pain if they have a facet joint issue. If they lean onto that same side, so assuming this is the side where I have a facet joint issue, or rotate onto that side, so I'm really closing down those facet joints, and that's going to cause the patient some pain. Now, what can be done about it? A number of things really. The best way to reduce one's symptoms if they are suffering from facet joint syndrome is exercise. So to strengthen the front of the core and strengthen the back of the core through the use of Pilates or yoga, pelvic floor, Kegel exercises. A lot of the research points to those types of exercises as being the best. Here at On The Go Physio, we do one-to-ones a one-to-one approach with the patient, so I can really focus in on whether the patient is doing the exercises correctly, and also teaching the patient ways to try and basically positions to get into that will reduce the tension on the facet joint. So for example, more of a slumped approach, if the pain is really acute and you just want a bit of relief, then a more slumped approach may help the patient momentarily. So if you think you are suffering from facet joint pain syndrome, whether that's in the neck, the mid-back or the low back, then come and speak to us at On The Go Physio and we will see if we can help you.